Oh, there's some new developments on the future of Obamacare. You know, the president made overhauling our health care system the centerpiece of his domestic agenda. But President-elect Donald Trump vows to repeal and replace the law, and now he says there are provisions that he would like to keep. So what will Mr. Trump's health care plan actually look like? Joining us now is Dr. Manny, Senior Managing Editor of FoxNewsHealth.com. Dr. Manny, good to see you.
Good to see you.
First fear of a lot of people, will 20 million Americans lose their health care coverage?
Absolutely no. I don't think so. If you listen to the president-elect's position as of late, he wants to create a system that parallels the care so that you go from one plan to another. This way you don't have any gaps in protection, and I think he's very bullish in really protecting the American public. You know, look, what he knows, and I think everybody in healthcare, I've been in healthcare for over 30 years. I'm an administrator of some sort in healthcare in my own hospital. And we realize that all these regulations, all of these mandates, everything that the Obama government did basically is like creating a project without considering all the risk factors. When Mr. Trump builds a building, he doesn't say, you know, he says, look, I want a building here, but then the architects go, they consider the weather, the material, the planning, the soil, and then they build him this beautiful building and it stays put. And what we have now is a collapse of a healthcare program over the last 8 years that's really now falling on his own because
premiums have been going up.
Premiums, care, doctors don't accept it. There's no access to good doctors and things. So I think that the new plan is going to take into consideration in Fox News Health. Since Monday, we've been writing articles in the different individuals that are around Mr. Trump, like Newt Gingrich plan in healthcare because he's been a big advocate of change. Ben Carson, we have his position yesterday. Today we have the Ryan plan online. So if you look at all the suggestions that all these individuals are bringing to the table, the president-elect is going to take the best things that he considers, and you're going to see a different kind of health care plan, what I call the THP, the Trump health care plan, and it's going to have a lot of positive things for longevity. That's what we want. We want this to be sustainable in the future.
He's talked about keeping the kids who are 26 years old, if you're home living with your parents or unemployed, keeping them, pre-existing conditions.
Yeah, I think that the things that you're going to see pre-existing conditions. I think you're going to see keeping kids on the planet until the age of 26. I think that those two things are for sure. I think you're going to see opening of insurance companies selling across state lines. Now that began this year legally, but the states have to be regulated because the problem with selling between insurance companies selling, let's say, to New Jersey, Connecticut, they have to get the state approval from the state. That has to happen.
And quickly, just there is one plan. Mike Pence says, he was the governor of Indiana, has the Healthy Indiana plan, and that's up and running right now. And they say that's kind of working.
And that basically is giving the states more authority over Medicaid dollars and reducing the cost. Hospitals need to bring down the cost, and they have to figure out how things work, and that's the problem. If you reduce costs, this is a sustainable plan, and I think this is exactly what the president-elect wants.
That HIP plan could be a model for
absolutely. Listen, a celebration in healthcare, in my opinion.
All right, Dr. Manny, thanks so much for explaining it. We'll see. Take care.